Welcome to the second part of the WSIC Hypertension Population Health Dashboard demonstration video. In this part, we will be looking at the hypertension dashboards within the clinical and lifestyle quadrants. The clinical quadrant provides some aggregated figures in the context of different classes of antihypertensive medications being prescribed. A user can decide the number of months they would like to look at by typing the number of months here. Let's have a look into the clinical overview dashboard, which can be accessed by clicking here. The dashboard allows viewing the Northwest London hypertensive patients cohort by the latest blood pressure category and results, the latest eGFR values, tests completed within a number of months, and antihypertensive drug groups prescribed in a number of months. The detailed information about the drug and classes can be found by hovering over the information icon. The dashboard is interactive, which means that clicking on any of the segments will update others accordingly. To reset the view, click back on the segment, or click on the View Original and select Original Default. One of the envisaged use case scenarios for this dashboard is to allow users easily identify patients with uncontrolled blood pressure. For the purpose of this demonstration, I would like to identify patients within the BALSA PCN who are over 80 years old and who don't have controlled BP. I will be looking at the period of the last 12 months. The dashboard is now reflecting my filter selection, allowing me to find out aggregate numbers for 80+ years old BALSA PCN patients with uncontrolled blood pressure in the last 12 months. In addition, users with the PID level of access will be able to access the patient list, which would reflect same searching criteria and will allow them to access individual patients' analysis. You will also be able to download the patients list in various formats by clicking on the black space in the dashboard and then on this icon. The detailed instructions regarding the download functionality can be found in the user guide. The download function is available on all WSIC dashboards, however, due to security reasons, not every downloading format will be available for every dashboard. To return to the clinical overview dashboard, press here. To navigate back to the main landing page, please click on the home icon. The clinical medication prescribed dashboard is the second and the last dashboard within the hypertension clinical category of dashboards, and it allows viewing the Northwest London patients with hypertension in a context of medication figures, latest Q-risk score, and eGFR values. To find out how the Q-risk score has been defined, please refer to the Hypertension User Guide. The KPIs in the middle section of the dashboard as usually reflect filter selection and include number of hypertensive patients, sum of fall or non-elective loss of conscience, Q-risk score between 10 and 20%, Q-risk score over 20%, and medication review within last 12 months. The blood pressure values graph provides number of patients depending on a user's filter selection, broken by diastolic and systolic blood pressure stages. It also allows a user to decide if would like to look at 12 or 18 months period of time. As usual, the dashboard is interactive. Clicking on a selected segment will amend others accordingly. The patient list is available for users with the PID level of access. Back to the landing page. The last segment is dedicated to the lifestyle in the context of the hypertension and provides aggregate numbers for certain hypertension-related interventions for a period of time specified by a user here. The lifestyle dashboard provides a more detailed analysis of those interventions. The KPIs, which as usual reflect filter selection, displays number of hypertensive patients with a specific comorbidities such as diabetes, heart conditions, coded CKD stage 3B or above, peripheral arterial disease, stroke and TIA. The graphs below break down the number of patients with hypertension by BMI scores and latest cholesterol values, both categories within 18 months' time, by smoking status, and by interventions offered in a specific number of months. The dashboard is interactive and patients with the PID level of access can navigate to the patient lifestyle list by clicking here. The list includes the exact date of the specified intervention for individual patient. Thank you for watching the second part of the WSIC Hypertension Population Health Dashboard demonstration video. To request an access to WSIC dashboard or to provide a feedback, please email nhsnwl.wsic support@nhs.net. Thank you for watching.